Hello everyone, this is video 3 on pharmacodynamics. In this video, we will talk mainly about the agonist and antagonist. So what are agonist drugs? Agonist drugs are the drugs that increase the action of a ligand. So say suppose there is a physiological ligand for a particular receptor, say adrenaline for beta receptor. And if there is a drug which increases this action, that is known as agonist. On the other hand, antagonist is which decreases the action of the agonist or the ligand. Okay. So agonists are chemicals that basically activate the receptor. They bind with the receptor, there is binding. So they have some affinity with the receptor and they activate the receptor to produce the same physiological effect which already exists. The chemical for that physiological effect exists in the body. And antagonist, we see that they bind with the receptor but they do not activate the receptor. Okay. So now these agonists are of different types. We have primary agonist and allosteric agonist. That is, primary agonist is, say suppose this is the receptor. This receptor has two binding sites. One is the main binding site for which there is a ligand present in the body. So this ligand binds to this receptor. Now if we add a drug or the agonist which can bind to this receptor site itself where the ligand is binding, then that is the primary agonist. And if it causes the full activation of the receptor, then that is a full agonist. Okay, so that will give the maximum response of that particular receptor activation. So that is full agonist. Primary agonist, if it binds to the receptor site where the ligand present in the body actually binds. Okay, so what will happen, that it will have a affinity and it is also going to activate the receptor. Receptor activation is there. Then there is another type of agonist, that is allosteric or allotopic agonist. That means this agonist binds to another site, another nearby site, doesn't bind on the site of the ligand binding, it binds on a nearby site and it also causes activation of the receptor. For example, we have GABA A receptor agonist. Okay, so GABA A receptor is there. An agonist like diazepam bind to this allosteric site. Then we have partial agonists. These partial agonists bind on this same site where the ligand is binding. However, this stimulates the receptor partially. So there is, as the name suggests, partial agonists, there is partial activation of the receptor. Okay. Now, if there is a partial activation of the receptor, say suppose the ligand already is present in the body, so physiological ligand is present and it is increased in concentration. Now, if you give this partial agonist, will this main ligand, the physiological ligand, will it be able to act? No. So this partial agonist is going to bind to this main site. Yes, there may be some competition. If there is a competitive binding, there may be some competition. But this partial agonist, what it will lead to? It will lead to a partial response. However, if this physiological ligand binds, it will lead to a maximal response. So you see that in presence of the main ligand, physiological ligand, actually this partial agonist is decreasing the response. So even though we are telling it is an agonist, but in presence of the physiological ligand, we are not getting the maximal response which we should get. We are getting only partial response. Okay, so that is partial agonist. However, in absence of this physiological ligand, because this partial agonist will produce some response, it is known as an agonist, right? Then we have the inverse agonist. Inverse agonist is that it will produce the response in opposite direction. Opposite direction. Okay. So basically there are certain receptors in the body which are constitutively active. That means without the binding of the receptor. That means say suppose this is the receptor. Now even if the ligand doesn't bind to this receptor, still this receptor is active. That means there are certain downstream events taking place within the cell causing some physiological function. Okay. Now, if you give a inverse agonist, it is going to go and bind on this receptor and it will make the receptor inactive now. So till now we were talking about inactive receptor and the agonist is making it active. However, when we talk about inverse agonist, remember that the receptor is constitutively, that is the term, constitutively active. That means even in the absence of the ligand, the receptor is active, and when this inverse agonist bind to it, then it is preventing that response. So there is a response in the opposite direction. So initially, say suppose there was a baseline secretion of any substances there, when this inverse agonist acts, then there will be decrease in the secretion. So the response is in the opposite direction. Okay, so that is known as inverse agonist. Then we have the antagonist. Antagonist, as I told you, they decrease the response. Okay, so antagonist again may be of different types. They may be receptor antagonist, where the drug is basically binding on the receptor. So we have the competitive interaction with the receptor, or that is also known as syntopic interaction, competitive or syntopic interaction. Then we have the non-competitive, or also known as the allosteric antagonism, because there is interaction of the drug with another side. Then we have chemical antagonism, physical antagonism, and functional antagonism. What are these? So competitive interaction is, say suppose this is the receptor, right? Now if this drug binds on the same site as that of the ligand, say ligand can bind here. Now if you add a drug and it competes with the ligand to bind on the same site as that of the ligand, that is known as competitive interaction. And this competitive interaction can be of equilibrium type or non-equilibrium type. So in equilibrium type, what happens, that there is competition, so it is going to decrease the response, okay, because ligand will produce a response. Now this drug when binds here, it will not allow the ligand to bind, and there will be decrease in the response. However, if the concentration of this ligand is increased, okay, so you increase the concentration of this ligand, what will happen? Now this ligand will compete with this drug more and will be able to bind at the site. So now the maximum response can still be achieved. Okay, so equilibrium type, if you increase the concentration of the ligand, maximum response can still be achieved. However, to achieve this maximal response, you need higher concentration of the ligand. Okay, then we have the non-equilibrium type. Non-equilibrium type is when there is irreversible binding of the drug with that of this site. So in equilibrium type, the drug is reversibly bind, that means it attaches and detaches. Irreversible bind, that there is a strong binding between the drug and the receptor site. So now ligand cannot occupy that particular receptor site. So now the maximum response also will be decreased. You keep on increasing the concentration of the ligand, doesn't matter, because it cannot replace the drug. Okay, so operationally this non-equilibrium binding is also known as non-competitive type. That is this one. Okay, because actually here also there is no competition. Ligand is not able to replace the drug because of very strong binding of the drug with the receptor site. Okay, then next is non-competitive or allosteric antagonism. Here the drug is going to bind on the nearby site, separate site it is going to bind, and this kind of antagonism is not seen very rarely. We have drugs of non-competitive allosteric antagonism. That is why I told you that operationally this non-equilibrium type is known as allosteric or non-competitive antagonism, and not allosteric, we can say non-competitive antagonism, because the strength of binding is too much, so hardly there is any competition with the ligand for the binding to the site. Okay, so these are the two types of receptor antagonism. Then we have chemical antagonism, where the drug reacts with certain chemicals. For example, chelating agents react with the toxic metals and they can remove it in case of poisoning. Then we have physical antagonism, where certain drug can absorb just by virtue of its physical property. It can remove certain substances. So that is just physical binding, like charcoal absorbs alkaloids. Then there is functional antagonism. Functional antagonism is where there is no direct interaction between the receptor or the ligand, but they act differently. Only the function is opposite. For example, glucagon increases blood glucose level, while insulin decreases blood glucose levels. So you are giving certain drug which is functionally different from that of the original ligand. It will act on different receptor, but the function will be opposite to that of the original ligand which we are talking about. Okay, so that is functional antagonism. So these are the different types of antagonists. Now, To explain this action of agonist and antagonist, we have two main theories that is known as receptor occupation theory and two-state receptor model. So what is this receptor occupation theory? Receptor occupation theory states that when the drug binds with the receptor site, it forms the drug receptor complex, and ultimately there is some action or no action. Okay, so this depends on how much affinity the drug has with the receptor site and also the intrinsic activity, or also known as efficacy. These terms we have already discussed in pharmacodynamics video 1. Okay, so that you can see, but here again we will discuss. Affinity is basically the strength of binding of the drug with the receptor site, strength of binding. Okay, intrinsic activity is that after binding, what is the change happening at the receptor level? Is it becoming activated or there is no action? Okay, so that is intrinsic activity. So let us see that with all these different types of drugs which we have discussed, how this affinity and intrinsic activity is different. When we talk about agonist, yes, it has affinity. In fact, all these drugs have affinity. They are going to bind at certain site on the receptor. Agonist has affinity plus it has intrinsic activity, which is equivalent to that of the ligand which is present in the body. So that is intrinsic activity is equal to 1. 1 is basically same as the ligand present in the body. Then we have partial agonist. Partial agonist also has affinity, but it has intrinsic activity which ranges from 0 to 1. Okay, so that is not maximal. 0 to less than 1 we can say. Okay. Then inverse agonist, that means the action is opposite to that of the original. So we can say that inverse agonist has affinity plus intrinsic activity which ranges from -1 to 0 in opposite direction, isn't it? And competitive antagonist, it has affinity but intrinsic activity is equal to 0. Okay, because we are telling that competitive antagonist only binds, there is competition but there is no change in the receptor because it is not allowing the ligand to bind, so there is no activity. Okay, so this is the first theory, that is the receptor occupation theory, which mainly talks about the affinity and intrinsic activity. Now second theory is the two-state receptor model. What this theory tells: according to this theory, the receptor exists in two states, that is the activated states, that is Ra, and the inactivated states, that is Ri. And normally these two states are in equilibrium. Okay, equilibrium doesn't mean that both are equal, both are present in same concentration. At equilibrium, at rest, normally most of the receptors are in inactive state. Okay, now we will talk about all those 4 drugs, that what they do, where they bind, which type of receptor. So we are not telling that there is single receptor, we are telling that it is in different states. So states means nothing but it is like, say suppose a conformation of the receptor is like this, and sometimes the conformation of the receptor may be little bit changed, maybe like this. Okay, so say suppose this is the activated state and this is the inactivated state, and most of the time the receptor is in this state. That's what we are telling. So ligand is not binding to it. Now suppose if you add a agonist, how it causes the changes. So this agonist, we say that it has high affinity for Ra, that is the activated state. Understanding? So before we were talking about intrinsic activity, now the intrinsic activity part we have left in the receptor itself, that there is an inactivated receptor and is the activated receptor. So here we are talking only about the affinity. So agonist has high affinity for activated state, so there will be activation, because this is the activated state of the receptor, and it also shifts the equilibrium towards the active state. Okay, that means once it starts binding to the agonist, more and the more receptors will shift towards the activated state, that is agonist. Then comes the partial agonist. Partial agonist, what happens, that it has high affinity to Ra, but it also has some affinity for Ri. Understanding? So yes, some of the receptors will be in inactivated state, some of the receptors will be in activated state, but obviously some equilibrium will shift towards the RA, because at rest I told that majority are in RI. Now more number of receptors have become RA, so there will be some response, that is the submaximal response which we were talking. So that is a partial agonist. Then there is inverse agonist. Inverse agonist, where it will bind? It will has high affinity for RI. But there is a but here, that it mainly works for receptors for which the equilibrium at rest is towards the RA. That means constitutionally, even at rest, most of the receptors are in RA state. I told you that according to this theory, most of the receptors are in RI state, but inverse agonists are active for those receptors for which constitutionally RA, that is the activated state, is active. That's what we discussed before also, right? So when this drug binds to the RI state, the equilibrium shifts to the inactivated state, and this response is going to decrease. Okay. Then finally we have the antagonist. An antagonist, what it does, it has a equal affinity for RA plus RI, equal affinity. So it binds to both and does not allow the agonist to bind to RA. So if agonist is present and it can't bind to RA, that means it will be same, whatever we were talking about resting, the receptors will remain in the same state, that is in the RI state, and hardly there will be any activity, because this antagonist binds to both of them equally, doesn't allow agonist to bind. Okay, so this theory is known as two-state receptor model. That means the receptor is in RI state or RA state. Mostly at rest, it is at the RI state, except for inverse agonist, where we are talking about the receptors which are in RA state. Okay, so that was about the theories which explain this agonist and antagonist action. So that was the third video on pharmacodynamics, where we discussed about agonist and antagonist and the theories which explain their action. In the last video on pharmacodynamics, we are going to talk about combined effect of drugs. So thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.